So very hearty welcome. This time we are going to discuss conus medullaris versus cauda equina syndromes. Okay? Yeah. So let us start with this. First, we need to have a basic, view of the anatomy. An idea of the anatomy is so important in order to understand these concepts. So in this, you need to know this very well now, right? See, what I'm talking is, as you can see, this is the spinal cord. This is the lumbar part of the spinal cord, say L1, L2, L3, so forth, and L5. And this is the sacral. This is the sacral part, this green bulb-shaped region. This is the sacral part. It has all the spinal sacral segments, that is S1 to S5. So here we discuss from L1 to L5, and this green bulb-like structure, there will be S1 to S5. So this is the spinal cord, and this, it terminates at the end in the form of a small ending part that is called the filum terminale, and that is the end of the spinal cord. So the end of the spinal cord, even the sacral segments, is at the level of between the L1 and the L2 vertebra. So this is the L1 and L2 vertebra. This is L1 and this is L2. So anywhere at the level of between L1 and L2, the spinal cord ends in the form of spinal terminal. And before that, we have L1 to L5 segments, and the bulb-like region, it is having the sacral segments, that is S1 to S5 segments. So this bulb-like region is called conus medullaris, like cone, okay, conus medullaris. And now coming, so this is normal, right? Till now it was fine. This is spinal cord, the segments of spinal cord, L1 segment till L5 segments, and sacral segments from S1 to S5 are present. Now these are just the spinal cord segments. From this must arise and originate the various nerves, the various spinal nerves of the corresponding segment. For example, L1 nerve, L2 nerve, L3 nerve, they must come. So for example, this is L1 nerve, so like that L1 nerve will come, and this which is showing is L2 nerve. For example, it's not exact, L3 like that, L like that, it occurs L5, and from this region will start coming all the spinal nerves, S1 nerve, S2 nerve, from here S3 nerve, S4 nerve, S5 nerve. So if you have to draw a very important orientation in your mind, the most lateral, which segments or which parts they are the most lateral, this is the most lateral, and this is most central in the body plane, this is the most lateral. So the most lateral will be the lumbar segments. So lateral most, the trick is also L for L, the lateral most are the lumbar segments, and here the medial most in the midline, you can see these S1, S2, S3 will come here, S3, S4, S5. So the medial most will be the sacral segments. In the medial there will be sacral. Always remember, the nerves, we are discussing about the nerves, the sacral nerves, they will be medially present, whereas the lumbar nerves, they will be laterally present. This orientation is so important. Okay, and this bulb-like structure, we discussed this point that it is referred to as conus medullaris, whereas all these horsetail-like appearing, all the nerve roots which are present, all so much density of nerve roots in such a small region of the body, they are present in great density. So this is called as cauda equina. That means the horsetail. So many nerve roots together, almost clustered and aggregated and coming out from the small region. So it is looking like a horsetail appearance. Okay. Now we will discuss more things about this. Right? So, as we discussed, the first point was at the level of L1 and L2 vertebra. What happens now? These are like fill in the blanks. We discussed the theory. Now also you have to tell me before I speak the point. L1 and L2, what happens at this level? The spinal cord terminates. The spinal cord terminates at the level of L1 and L2. Between L1 and L2, the spinal cord terminates. The conus medullaris, it has only the sacral segments S1 to S5, whereas cauda equina, it has all the segments L1 to L5 nerve roots, and the nerves and respectively, or the sacral S1 to S5 radiating nerve roots in the form of a horsetail. So always remember this conus medullaris, the conus medullaris part, the conus part has only the sacral segments, as you can see again in the diagram. Never forget this, the conus part. See this conus part is having only the sacral nerve roots S1 to S5, whereas all this cauda equina this side and cauda equina of this side, it is having the lumbar as well as sacral, L1 to L5 as well as S1 to S5 nerve roots, and the respective later on continuing in the form of nerves. Now coming to important differences between the two, important differences, that is conus medullaris and cauda equina. So the first thing is that You use your common sense. Whenever conus medullaris will occur, for example, there is all of a sudden there is a trauma, so it usually the onset is sudden, abruptly it happens, and bilateral, because such a small conus is present, and that is present in the center, in the midline of your body. For example, there is any trauma, there is any tumor, there is any infection, anything will involve the whole of the conus, because it is actually a very small thing. It is not very diffuse, it is just a small node like structure which is present in the center of the body. That means both involvement, means bilateral involvement will be there, since it is present in the center of the body, and it will happen all of a sudden, abruptly, bilateral. Whereas cauda equina, for example, this is the back of the person. So cauda equina of this side, cauda equina of this side. So there is a possibility that only one sided trauma may occur. So it may be unilateral. Usually it is unilateral and gradual. Not all of a sudden the manifestations occur. It is gradual and unilateral. Whereas this is in the center. So the manifestations which occur in conus medullaris syndrome, they are bilateral manifestations and very sudden onset. Now coming to reflexes, use your common sense, because S1 to S5 are gone. The ankle reflex is absent but knee is present. In cauda equina, this right side is cauda equina, right? All the L as well as S, they are gone, means knee and ankle, both of them will be absent. Now coming to the radicular pain. The radicular pain, the name itself is telling it is because of compression of the nerve roots. So the radicular pain, which is by virtue of compression of the nerve roots. So here actually there is more chances of compression of the nerve roots. So here the radicular pain will be more, here the radicular pain will be less in case of conus, because the radicular pain will be less, the nerve roots are not there, it is only the sacral segments of the spinal cord. Now coming to the next point, lower back pain. Now here there will be more of lower back pain, because this is present in the center, this conus, so it will cause more of lower back pain, whereas this is present more in the periphery, like nerves are coming like that, so it is accredited to cause lesser lower back pain. So the one point is for one, another is for another. So use the common sense. Radicular pain means compression of the nerve roots. Nerve roots will be present a little laterally, that means cauda equina, whereas lower back pain in the center, so it will originate from the conus, and more in conus medullaris syndrome. In sensations, there will be bilateral numbness. Again, I told you, because this is such a small region in the center of your back, that all the manifestations are bilateral, so numbness will also be bilateral. Here the numbness will be asymmetric. We cannot say anything, it will be asymmetric, because you don't know which nerves are involved, bilateral, unilateral, lumbar segments, lumbar nerves, or sacral nerves, so nothing is predictable, so it's asymmetrical. The motor strength, now use your common sense. Conus medullaris is still a part of the spinal cord, it is still your spinal cord, the distal, the ending part of your spinal cord, so therefore it is an upper motor neuron lesion, so hyperreflexia. Whereas cauda equina, the nerves which are originating, they are going to be compressed, or they are going to get severed, so therefore it will be like a LM and lower motor, so there will be areflexia. So this is also a striking point of difference. The impotency, that means erectile dysfunctioning, will be here, because the conus medullaris has all the sacral segments, so S1 and S2 high chances of being involved, and so erection, that is parasympathetic, S1 and S2 will be involved. Here in very few cases there will be impotency. Last point is the sphincter, the sphincter's involvement. So here what happens, the sphincteric involvement also occur early, because which sphincters, they are mainly the S1, S2, means S2, S3, S4 segments of the spinal cord are gone, so parasympathetic supply to the bladder and to the GIT, etc., will be gone. So what happens, the role of parasympathetic is to cause contraction. For example, talk about the bladder. If the parasympathetic nerves are normal, the bladder will keep on contracting, but now the parasympathetic is gone, so there will be no contraction. Because of that, there will be no contraction of the bladder, so the bladder will remain sort of little flaccid state. It will keep on accepting the urine. It is flaccid, it is not contracting, there is no tone, so atonic bladder keep on accepting the urine, the which is coming from the ureters and filling into the bladder. It keeps on filling till the stage of dribbling, and so there is urinary incontinence as well as fecal incontinence. So remember always, there shouldn't be any confusion. In conus syndrome, only sacral segments are involved, so S2, S3, S4, the nervy irrigants is involved, the pelvic nerve or nervy irrigants is involved. So because of that, there is no parasympathetic supply, so the bladder cannot contract, the bladder will remain sort of lesser tone, and in a relaxed state it will keep on accepting the urine until it starts to overflow. Whereas in case of cauda equina syndrome, there will be opposite. In cauda equina, the lateral most is lumbar, and there are chances that lateral most will be involved first. So lateral most is lumbar, so L1, L2, that means sympathetic will be gone first. When sympathetic will be gone first, what will happen, the role of sympathetic is to cause relaxation. It will relax the sympathetic nerves and the nerve of filling, they cause the relaxation relaxation of the urinary bladder. So now, because the relaxation of the urinary bladder is not there, the urinary bladder is in a sort of small urinary bladder which is not relaxing, which is not accepting more urine. So it won't accept the urine coming from down the way from the ureters. Because of that, the outflow will also decrease, because filling only is less, so outflow will also be decreased, the urine output will be lesser. And the condition, since output of urine is lesser, we will feel like the person is not urinating at all. So it will be called as urinary retention. So there shouldn't be any confusion at all that in case of conus medullaris syndrome, it is present in the center, it is spinal cord part. Always the sacral segments are gone. Because of sacral, there will be no contraction. When the urinary bladder is not contracting, it is in a relaxed flaccid form, it will keep on accepting the urine and overflow. Whereas here the sympathetic is gone, it will not relax, it will remain hypertonic. You can remember, it won't accept even the normal amounts of urine. When no urine comes into the bladder, no urine will go out of the bladder through the urethra out of the body, so it will appear like a condition of urinary retention. So that was all for this video. Thanks a lot for watching. Like, subscribe, share and comment.